Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. We have Dr. Yaffe and Dr. Huyer here today, so I'll turn it over to them for some brief remarks.
Thanks very much. Good afternoon, everyone. I want to first take this opportunity to acknowledge that today is Global Hand Washing Day. Today serves as an important reminder that hand washing with soap and water is one of the easiest and most effective ways to avoid getting sick and to avoid spreading germs to others. So please make sure that frequent hand hygiene is part of your everyday routine. Slowing the spread of COVID-19 is literally in all of our hands. Today we're reporting an increase of 783 new cases of COVID-19 in Ontario. Most of these cases continue to be concentrated in 4 public health units: Toronto with 239, Peel Region 136, York Region 127, which is a new record high for that region, and Ottawa with 89. Other regions are also seeing high and increasing case counts, including Durham Region with 40, Halton Region 28, and Eastern Ontario with 23. Slightly over half of the cases, 51%, reported today are among those under 40 years of age. Last week, 58% of cases were in that age group and 60% the week before that. The proportion of cases in those 80 years and over this week is 4% and was 2.76% 2 weeks ago. So this is a trend that we have been seeing over the last few weeks, a moderate increase in the proportion of cases in those under 40 and a slow increase in the proportion of cases in older age groups. In terms of testing system-wide yesterday, there were almost 40,000 case tests completed. What is concerning, though, is that our percent positivity has been steadily going up. Yesterday, it was 3%, today 2.9%. With our cases rising these last few weeks, we are seeing a steady increase in hospitalizations. Today, 253 people in hospital with COVID-19, which is an increase of 22 from yesterday. I'm going to let Dr. Huyer provide more specifics on the trends in clusters and outbreaks, but overall we do continue to see clusters associated with large social gatherings, including indoor birthday parties, family and friend gatherings, and household-to-household visits, outbreaks and exposures in gyms and sports settings, and an increase in outbreaks in long-term care homes, as well as retirement homes. Similar to what's been noted previously, many public health units continue to report that the number of contacts per case is high, and cluster investigations involve many locations and businesses. And now I'm going to turn it over to Dr. Huyer.
Thanks, Dr. Yaffe. Good afternoon, everybody. Thanks for letting us be here today. I brought my hand washing, my alcohol-based hand wash, because I carry that with me everywhere, and multiple hand washes on a regular day, and celebrating Global Hand Washing Day as well with Dr. Yaffe. Today, we are reporting 26 new outbreaks, and that is a notable number. We have been around 9, 10, 13, 14, 16, 26 is a substantial number. And it's representative of continued progression of increased number of outbreaks. And if we look at over a week-long period, there was 110 reported over the past 7 days, and over the past 14 days, 233. It's now getting to be a similar number across the comparator of the previous 2 weeks. So between September 16th and the 30th, there were 187 outbreaks. Not only are there an increased number of outbreaks that are focused in Toronto, Peel, and Ottawa, but we're also seeing them in adjacent areas. York, Halton certainly have seen increased numbers, and Eastern Ontario, also nearby Ottawa, have seen increased numbers, not only of the outbreaks, but also, as Dr. Yaffe pointed out, in York, a substantial number of cases, but also the case per population is continuing to increase in those areas adjacent to the current Toronto, Peel, and Ottawa. The proportionality, as Dr. Yaffe illustrated in a different way of the types of outbreaks. We're seeing about 40% that are in the vulnerable sector, which would be the long-term care home, the retirement homes, group homes, other vulnerable settings where people are receiving care and require care. Clearly, a very important thing to think about, and fits with what Dr. Yaffe talked about when we talk about the age differential. It's getting the younger is a smaller proportion and the older is a greater proportion, with a greater risk of those more vulnerable, and also a greater use of hospitalization and health care in the older population because of the potential that they have other health problems. All of the areas that are of key focus have neighborhoods with notable clusters, and it speaks again to some of the concern about the transmission within social settings. And when we look and try to get a better understanding of the outbreaks, some of the key areas are those areas and settings where people are in close proximity. They're not able to maintain their masking, or there's a reason that they're not masking. So when you're eating somewhere, you may not be wearing a mask so that you can eat or consume some beverages, and that in of itself places a greater chance and a greater risk of transmission. And so the settings where we're seeing this are in social gatherings, as Dr. Yaffe talked about: parties, birthday parties, social gatherings, neighborhood gatherings, sports and gyms, where we've seen reports from basketball teams at practices and at games, and in a basketball area, volleyball team, hockey leagues, pickup, spin class that Dr. Yaffe talked about yesterday, and also a variety of other retail locations and workplaces, not as frequent as we do see in the social gathering ones. So overall, we are continuing to see, unfortunately, an increasing number of outbreaks concurrent with the increasing types of cases, greater age and a greater vulnerability sector, and moving out from the areas where there was focus. I think we'll open for questions at this point, or did you have any other words?
No, that's
Thanks.
fine.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
The first question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, doctors. Just wanted to check in. The NDP is raising concerns today that nursing homes are still allowed to have 3 or 4 residents in a ward room, as long as they already live there and it's not a situation being created by, say, like a new resident coming in. So is that the case? And if so, why is that still allowed?
That has just come to my attention recently, and we have been trying to revise the directive so that it's clear that it's not only for new admissions or transfers that they cannot exceed 2 people in a room, but it's for even transferring people internally. They really should not be having more than 2 people per room, but that is something that I will follow up again with the Ministry of Long-Term Care.
Follow-up?
All right, that's great. Thank you. Was Dr. Huyer going to pipe in?
Just say hi, Mr. Ferguson.
Oh, hello. Thank you.
You're welcome.
Can we just explore that positivity rate statistic in a little more depth, please? So I know that I think Dr. Williams has told us last spring, at some points when it was crazy, it was up around 7 or 8%, maybe a bit more. So how can we make people understand what that means? Because you often hear people saying, well, there's not as much testing now because you have to make an appointment. So, here we are. So what's the big deal? So can you kind of take us a bit deeper into that?
Well, I have to say, sometimes I get perplexed by the question, because we're upwards of almost 3% of those being tested being positive. That's a significant number of cases, illustrated by the number of cases that we're seeing, and the positivity rate is notably higher in areas where there's greater infection. So it's not when the numbers were we're still doing approximately 40,000 tests per day. So our numbers of testing are not going down. The testing continues to happen. What we're seeing is people who are coming with symptoms, people who are contacts of those who are positive, and people who are in outbreaks. And there's more of all of those things happening, unfortunately. And we're finding, therefore, the testing is illustrating and capturing that. So we're able to, therefore, provide the care to those who need the test, to be able to provide the contact opportunity to stop further transmission by having that positive test, finding out who has it, then limiting further transmission by notifying and working with those who may have been contacted. Further, we've also seen increased percentages in different age groups. So we know the 18 to 24-year-old and the 23 to 29-year-old are around 2.5 generally. That 3% is the province generally. Then we can drill down into the positivity rate within specific age groups, and it fits with the demographic that we've had, which is about 50% are under age 40. But we continue to see increasing positivity in all of the age groups as we break them apart. So I'm not sure if I've answered the question, but the bottom line is the testing numbers have not gone down substantially, and we're continuing to see more people testing positive with that number. So it continues to be concerning, but yet hopefully finding those people that are positive and allowing proper care and proper response.
If I could just add, on top of what Dr. Huyer said, I think that the positivity rate it's a one indicator. It's an important indicator, but it's one of the many indicators that we look at in terms of the trends. We look at the rate of cases per 100,000 population. We look at their distribution. We look at the trend over time. We look at severity indicators like hospitalizations, ICU, ventilators, and so on. So all of them are showing the same trend, but we don't just look at the positivity rate. It is one of the many indicators we look at.
Next question.
The next question comes from Fallon Hewitt at the Hamilton Spectator. Please go ahead.
Hi, thanks for taking my question. This is a question for Dr. Yaffe. The YMCA of Hamilton and Burlington have changed their rules around masking due to increases of cases in the region. So now they're mandatory at all times, exercising and all that jazz. And I was going to ask, what do you think of gyms tightening their rules ahead of even being told to by the province?
What do I think of the gyms tightening their rules ahead of the province? Was that the question? I think that's probably a good idea. They might want to consult with the province on the details. Just to clarify, I heard there was some confusion about what I was mentioning yesterday. Based on the experience with the Spinco gym in Hamilton, where my understanding from the local medical officer of health was that the gym was implementing all the provincial guidelines, and yet there was an outbreak. So I therefore have asked the public health measures team to look at strengthening the measures that are recommended for that kind of setting in health units that are not in modified stage 2. So we're not looking at Toronto, Peel, and so on, where we've basically closed the gyms. We're not looking at those. We're looking at the health units where gyms are still allowed to be open and modifying or strengthening the measures that are being recommended in those settings. So if a gym decides to go ahead on their own, I would support that.
I think I'll just remind everybody that everybody has a role to play in the situation, and the public health measures are directed to the individual. And people have heard me say this before, but it's the individual who has to take the initial steps. It's the action of that person to be able to reduce the chance of transmission. And that's on Global Hand Washing Day, an important thing to remember, how often and how frequently to wash hands, because that is how things are transmitted in many situations. It's important to have the physical distancing, important to wear masking when there cannot be appropriate or the same physical distancing that's been recommended. And everybody works together to try to think this through. So if going into a situation where there may be others in a social setting, recognizing who may be there, recognizing how you would take those steps to take appropriate precautions to reduce the potential for transmission or the potential for you to be subject to transmission, all of those things. And when we speak about a setting, doing steps to consider further protections, that's everybody. It's an example of everybody working together to think about how to do this in the most effective way.
Follow up?
And when can people expect those new measures to be announced, Dr. Yaffe?
I don't know the exact timing. I'm hoping shortly. I'm hoping very soon, but I don't have the exact time.
Next question.
The last question comes from Colin DeMello at CTV News. Please go ahead.
Hello, good afternoon, doctors. I'm wondering about the similarities that you guys see between York and Halton and Toronto, Peel, and Ottawa. Are you seeing a similar trajectory? Like, is York and Halton now at the place that Toronto, Peel, and Ottawa was? And are you recommending, or is there going to be a recommendation to have the similar restrictions as the big three now in place, imposed onto York and Halton?
I think Dr. Yaffe commented, and I'll turn to her for just a minute, but since I raised that topic initially, we are seeing increased numbers of cases and increased observations. There are many things to consider, and Dr. Yaffe explained it much more effectively than I did as far as the multiple things to think about when looking at a region. But what we are seeing is increased number of outbreaks. I can speak to the outbreaks in those areas that are similar to the types of outbreaks that we have observed in Toronto, Peel, and Ottawa. And so certainly need to be looking at it carefully, looking at it from all of the different factors that Dr. Yaffe's talked about.
Yeah, thank you. I would say that, yeah, we are concerned particularly about York and Halton, given the numbers we're seeing. We're, working very hard to bring forward recommendations to government as soon as possible for a decision regarding those areas.
Follow up, and this is the last question.
Okay, and if I can ask about the social gathering restrictions. It's been nearly a month now since social gatherings were restricted to 10 indoors and 25 outdoors, yet we still seem to be having outbreaks associated with indoor gatherings. I'm just, are part of your recommendations going forward going to be more restrictions on those social gatherings beyond what we already have? And are you disappointed that, a month later, social gatherings are still part of the problem here?
I sound very like a mother. Well, I am a mother. I am disappointed when I hear about these things, but it's human behavior, as Dr. Huyer said. I think that the bottom line is everybody has to think about every interaction they have with people. Anybody other than people you live with. It doesn't matter if it's a good friend or your aunt. Just think anybody that you are going to be within 2 meters not wearing a mask, you are posing a risk to them. They are posing a risk to you. So that doesn't mean we're saying don't go out, but we're just saying try and minimize going out. Minimize, obviously you have to hopefully exercise, you have to go shopping for food, medical appointments and so on. But it's so important right now. We know the numbers are going up. We're in the wave 2 of a serious pandemic. We don't want this to keep going. We want to minimize the impact on businesses. Right now in the 3 health units where we have modified stage 2, it's a 28-day period. If things don't get better, that may have to be extended, and that has serious health implications for a lot of people. So I guess we're imploring everyone, don't get together with a bunch of people if you don't have to, and if you do, wear a mask, stay 2 meters away. Obviously, don't go out if you're not feeling well, and wash your hands. So I know those are, boring messages you've heard 1,000 times, but that is really how we're going to control this.
Colin, you ask, are we disappointed? That's a hard word. I have to say I'm sad. I have to say that it's terrible that we're seeing long-term care homes having more and more infections. I have to say I'm distressed that schools see more kids coming with infections or that potential. I have to say that I'm sad for many of those different things, because we want the schools to stay open. Kids are doing better when they're in school, from everything I've heard and everything I hear, from anecdotal all the way through from those who provide care from a psychosocial point of view for kids. Kids learn. All of these things are crucially important for us to be thinking about and taking all those steps to take our own personal responsibility to try to ensure that we protect those most vulnerable in our society. And yes, it's intrusive, and yes, it's troubling, and yes, it's difficult, but it's just so important for people to think about exactly what Dr. Yaffe said, is to minimize those personal interactions to those most essential. And when you get into a social setting, recognize that not everybody is going to clearly be demonstrating their illness, and there's that potential for transmission. This is an incredibly infective virus. More than any of us could have predicted early on and understood, it just continues to be challenging and continues to be spreading in ways that we wouldn't have, 7, 8, 9 months ago thought. And so it really is something that's so important for everybody to think about that and to take those steps to protect those most dear to all of us. And we were all kids once ourselves. And so thinking about the value of kids in the school and how to consider all of your interactions, consider, is that something that's important? Consider about how you can do that in the most safe way. That's what I think is a response that I feel from a personal point of view and a professional point of view.